So here are 7 simple things patients say that actually sound very simple but are not actually that simple and may have a dangerous underlying disease behind it. For those of you who do not know me, this is Dr. Shahlar Binte Shafi. I'm a surgical resident in Mugda Medical College Hospital. Our patients do not usually use the textbook language. The textbook language is very theoretical and it does not really correlate with what the patient is trying to say. So we need to understand what the patient is trying to say and correlate it with our textbooks, and like there should be, you need to build a connection between these two languages. The textbook language is a little bit sophisticated, but when the patient explains those symptoms, it's I would say it's a little bit informal, and sometimes it's very different from the theory we learn. So I'm going to give you some examples, and I do really think they will help you in your clinical rounds or wards or just seeing patients. So the number one sentence some patients use is, previously I could eat a lot, but right now I feel very full very early. So what do you think it is? Yes, it is early onset satiety. And what does early onset satiety mean? Early onset satiety in an older patient with weight loss may mean gastric cancer, and you must exclude it after you listen to the symptom. Number 2. So if your patient complains about, my clothes are suddenly feeling loose, why is that, doctor? So what do you think they're trying to explain you? It actually means unexplained weight loss. And when you're thinking about unexplained weight loss, we can think of two very clear things. One is tuberculosis, another one is it a GI malignancy? Number 3, I feel a sudden heaviness in my chest. So remember that your patient will not always explain the pain of MI like it is a pain. The patient might say it's just a heaviness. So you have to understand, maybe the patient is trying to say that he's having a central chest pain. He might just explain it like it's a heaviness on his chest. So you need to think about myocardial infarction and angina pectoris in this scenario. Number 4, I have been feeling constipated lately. So what will you do next? You'll just give a laxative and send the patient home? No, you cannot do that, obviously. If the patient is an older adult, he's having unintentional weight loss and he's complaining of new onset constipation, we need to think about colorectal cancer and exclude it before sending the patient home, obviously. Number 5, my husband is saying my voice has been changed lately. What do you think it means? Yes, correct. So if there is hoarseness of voice more than 3 weeks, we need to think of laryngeal cancer. Number 6, if a patient comes to you and says, my legs are swelling, what do you think? No, your patient is not getting fatty or getting healthy. You need to think about, tell me. Number 1, heart failure. Number 2, there may be a kidney cause. Number 7, a patient comes to you and tells you, I feel breathless or tired while changing clothes or even doing simple tasks. What are you thinking about? Yes, correct. You're thinking about the patient may be anemic or the patient may be going into heart failure. So I know these things are pretty simple, but I know that sometimes we listen to the symptoms and we think things are very normal. But then when we do the workup, then we see there are always those signs, those early onset satiety, early onset constipation in older adults. The signs were there. So it is upon us to understand and to really grasp what the patient is trying to say and relate it with our textbooks. And we have to be actually we have to actually understand the language of the patient, because it is not always the same as theory. The patient will not come and tell you that, doctor, I'm having unexplained weight loss. The patient will come and tell you, doctor, my clothes are becoming loose. What do I do? Why is that happening? You need to understand that it is unexplained weight loss. You are the doctor. So that's all for today. I'll see you in my next video.